You know, an ectopic pregnancy is one of those medical emergencies that can be hiding in plain sight. And recognizing the warning signs, it's not just important, it can be the difference between life and death. So today, we're going to break down exactly what those signs are.
So imagine this. You get a positive pregnancy test, and there's this wave of emotion, right? But then it's followed by some abdominal pain, maybe a little bit of spotting. Now, it could be a lot of things, but one of the most serious possibilities is an ectopic pregnancy. So, what are the warning signs we absolutely have to know about?
For decades, doctors have been taught to look for what's called the classical triad of symptoms. These are supposed to be the three hallmark signs that just scream ectopic pregnancy. But what if I told you that this textbook case, well, it's often the exception, not the rule.
Let's break this triad down. First, you've got amenorrhea. That's just a fancy word for a missed period, usually somewhere between 4 and 8 weeks. Second, there's lower abdominal pain, and it's typically just on one side. And third, some kind of vaginal bleeding, which might be as minor as just some spotting. When all three of those show up together, yeah, suspicion is definitely high.
But here is the absolutely crucial statistic. Only about half, 50 to 60% of all people with an ectopic pregnancy will actually have all three of those classic signs. And this is what makes it so dangerous. It means that in almost half the cases, the picture looks different, which makes it way harder to diagnose from symptoms alone. So let's explore the first path this condition can take. This is when it's unruptured. This is the stage where the signs are often really subtle, and honestly, they can be easily confused with a totally normal early pregnancy or even just a stomach bug. See, in this early stage, the pain might just be a dull, one-sided cramp. The bleeding, maybe just some light dark brown spotting. Then you add in some nausea, breast tenderness, feeling like you have to pee all the time. Well, that sounds exactly like a normal early pregnancy, doesn't it? This deceptive overlap is what allows the danger to grow, completely unnoticed. This quiet, confusing picture, it can all change in an instant. If that pregnancy keeps growing where it shouldn't, like inside the fallopian tube, the pressure just builds and builds until the unthinkable happens. And that brings us to the second path, the ruptured state. Okay, this isn't a subtle danger anymore. This is a full-blown medical emergency where every single second counts. The symptoms transform from vague to incredibly severe. The shift is so dramatic. That dull cramp becomes a sudden, sharp, stabbing pain. And here's something that might seem counterintuitive. The vaginal bleeding might be minimal, or it might even stop completely. Why? Because the real, life-threatening bleed is now happening inside the body. With a rupture, a whole new set of critical signs can appear. One of the most specific is shoulder tip pain. It sounds strange, right? But it happens because internal blood starts to pool up and irritate the diaphragm. And the diaphragm shares a nerve, the phrenic nerve, with the shoulder. So it's a referred pain, and it is a huge red flag. This is often followed by fainting, dizziness, and all those classic signs of shock, like a racing heart and cold, clammy skin.
Okay, so those are the symptoms a person feels. But what does a doctor look for during an actual examination? Well, there are several key physical signs that can help them piece this whole diagnostic puzzle together.
One of the most telling signs is called cervical motion tenderness. During a pelvic exam, if just moving the cervix causes this intense, sharp pain, that's a massive red flag for internal inflammation. In fact, the pain can be so sharp it has a nickname, the chandelier sign, because the patient might involuntarily reach up as if they're grabbing for a chandelier. Another key finding is something called an adnexal mass. Now, the adnexa, that's just the area right next to the uterus, where your fallopian tubes and ovaries are. A clinician might actually be able to feel a tender, swollen mass on one side, and that could be the ectopic pregnancy itself. So beyond those two major signs, a doctor might find that the uterus is a little bit enlarged, but still smaller than you'd expect for how far along the pregnancy should be. They might also feel a sense of fullness in a space behind the uterus called the pouch of Douglas, which is where blood can collect. And of course, on the abdomen, there could be serious tenderness, maybe even muscle rigidity, as the body tries to guard that whole inflamed area. All right, now, just to make things a little more complex, the symptoms can change dramatically, depending on where the ectopic pregnancy has actually implanted. The location changes the entire story. I mean, just look at this table. It shows you how much location matters. If it implants in the narrow part of the tube, the isthmus, it's going to rupture early and cause sudden, severe pain. But if it's in the interstitial part, where the tube joins the uterus, it can actually grow for much longer. And when that one finally ruptures, the bleeding can be catastrophic because it's right next to the main uterine artery. And then you have something like a cervical ectopic, which can show up in a totally different way, often with painless but very heavy bleeding.
And then there's the chronic ectopic pregnancy. This isn't an acute emergency. It's more of a slow burn. It's caused by repeated small bleeds that create a pelvic mass over time. This shows up as persistent pelvic pain and irregular bleeding, and it's notoriously difficult to diagnose. It often gets mistaken for other things like pelvic inflammatory disease. So, what is the crucial point to take away from all this? It's that an ectopic pregnancy doesn't have just one story. It has so many different faces, from the really subtle and confusing ones to the sudden and life-threatening emergencies. I think this really sums it up perfectly. The story of an ectopic pregnancy can be a quiet whisper of mild pain and spotting, or it can be a sudden scream of a medical emergency. Knowing what both of those look and feel like is absolutely crucial. So we're left with one final critical question. Given how varied and how dangerous all these symptoms can be, if you experience any unusual pain or bleeding in an early pregnancy, what is the single most important step you can possibly take?